What is up, everybody? Welcome to the Strength Solutions Podcast. We're on Apple and Spotify. You can rate and review us. Also, check us out on YouTube. You can subscribe down below, comment. Then, if you're looking for a website, it's strengthsolutionspodcast.com. We have free guides, free blogs, and programs on there for purchase. Also, if you're looking to email us future fitness questions on our podcast, it's strengthsolutionspodcast.com or at gmail.com. Then, if you're looking for us on social media, it's Strength Solutions Podcast on TikTok, Instagram, and Facebook. On Instagram, I'm Strength Solutions Edwin.
I'm Strength Solutions Nathaniel.
All right, guys, we have a great podcast today. We have a special guest. His name is Matthew. I'm going to allow him to tell his beautiful story about being part of chiropractic world.
All right. I appreciate it, guys. Thank you for having me.
Yes, thank you for being here, man.
Yeah. So starting off, just kind of a little bit what got me into chiropractic really was, I've been an athlete my whole life. So I've been doing martial arts since I was like 7 years old.
Oh, cool.
I have a black belt in Taekwondo.
Wow.
I did jiu-jitsu for about 12 years.
This guy can kill you, bro.
Yeah. So don't fight him. Got it.
So I've done a lot of that. I grew up playing football. I played 2 years of junior college as well. And, it was I've always been fascinated on just how the body moves and how we can optimize that. So, throughout the years, torn ACL, labrum, concussions, you name it.
Golly.
Done it. And, it's just like, hey, how do I recover? Because sometimes it was a thing where I would do physical therapy, but, my insurance wouldn't cover that extra steps, and it's like, okay, I'm going to have to kind of take this on myself. But I can remember 2 moments that really made the difference. So the first one was training jiu-jitsu, got thrown. If you've trained before, it's Uchimata. So I got tossed on my head and on my shoulder there, and I bounced to my feet.
Damn.
Yeah, it was, I got up, a lot of adrenaline, so I was like, all right, let's go. And then it just hit me, and I felt like I was paralyzed, and I just fell to the floor.
Dude.
Yeah, it was so intense, and from I get goosebumps talking about it. You can see.
Yeah, whoa, literally, yeah, goosebumps on him, guys.
And every time I tell that story, it's the same thing. Like it just hits me. But
wow.
So, I went to my primary care physician, recommended some pills. Like, hey, take these. Hopefully you'll feel better in a couple of weeks or so. Didn't work, so went into physical therapy, did a few rounds of that, and it got better, but I wasn't able to train. I wasn't able to lift. I wasn't able to do any of that. And I was like, hey, there has to be another solution. And I went back to the primary care, and she told me, hey, maybe you're just not going to be able to lift anymore.
No,
and
God.
Yeah, exactly. Oh. And to me, that was like, I can't go without lifting or some type of active activity. So,
so in that moment when they tell you that, what's running through your head? Like, are you thinking like, I may not lift forever, or I'm going to figure it out?
I'm going to figure it out.
Okay.
Yeah. Right away. I was like, no, I
Yeah.
was like, no, yeah. I just looked at her. I was like, I shook my head, and that was that.
Bye.
Yeah, bye. But luckily, I found a chiropractor near me, a sports chiropractor, similar to what I do.
Okay.
And he figured it out within the first visit. He adjusted me that day, 80% better.
You're kidding.
80% better. He's like, hey, give it a week or 2. The numbness, the tingling, all the pain that's going down your arm will be gone. And exactly that.
Dude.
And from there, I was like, yep, I'm going to chiropractic school.
What did they find that was wrong?
So he said that he only and I see it as well now, but more for jiu-jitsu athletes, wrestlers, combat athletes, having that fall, we have those 3 scaling muscles there. So that middle scaling, because of the impact that I took, it's connected at the first rib. So that caused it to elevate. So now it's pinching on the brachial plexus. It's coming all down my arms. So as soon as he adjusted that there, it was a big shock to me. But man, it just, like I said, 80% better. I was like, whoa,
Wow.
And then once that numbness ting was gone, it was like, all right. And, back to it, was competing again and, back to normal.
Wow.
Yeah. So
It's like magic, man.
yeah, in a way, sometimes it is. It's crazy. And people who haven't had chiropractic care before, especially, people who are incorporating the corrective exercises and things like that to make sure that these adjustments are sticking. It kind of blows their minds. They're like, oh my gosh. Like I have patients that tell me like, where were you 20 years ago? Because they've just never experienced that. And so that was amazing. So ended up going back to school, getting my undergraduate in exercise science, went to Parker University up in Dallas. So that's where I got my doctorate in chiropractic. And first year out of school, I herniated my disc. Now, this was terrible. It was really bad. So I really feel for my patients that come in and they're like, hey, I herniated a disc, and I can kind of relate. So with that, that's what kind of created the model that I'm doing now. Sorry, I'm getting a little emotional with that, but
How did you herniate your disc?
So, there wasn't a specific trauma. It just happened over time.
Like chronic.
Yeah, chronic. Yeah, it just kind of came about. I was like, okay, my back's really hurting. Just kind of pushed through it. Being a chiropractor, the place I was working at before, we only adjusted. So it was like adjust and then adjust and adjust like every 10 minutes. And
every 10 minutes. Damn.
Yeah. It was get in, get out kind of situation.
Wow.
And for me, it wasn't really ideal, but it was like, hey, this is my start. Let's kind of grow from here. And I've learned a lot from it. So I really appreciate that. Yeah. And the people that were there. But yeah, it just kind of happened over time. But as I continued with, further education and learning like dynamic neuromuscular stabilization, that was like the turnaround for me, because it started off very simple rehab exercises. And whenever I started to get the certification in those courses, like I said, like that was like the turnaround. Now I'm back to doing deadlift. I just did deadlift the other day. I did gorilla rows.
How much? How much was your deadlift? Come on.
It's not that much right now.
405, bro. 405.
There you go.
We'll work up there. But no, but like, I did that, it was 2 days ago or so. And
nice, man.
It blows my mind because I was in so much pain. Like I couldn't get out of bed. It just rolling over, it was so bad. So I'm just grateful to even be able to lift again and be active again the way I am.
So you said something in there, dynamic neuromuscular stabilization.
Yes.
Is that what you said? Can you explain that a little bit?
So dynamic neuromuscular stabilization, it has a lot to, simply put, it has a lot to do with the interabdominal pressure that we are be able to create in the lumbar spine.
Mm-hmm. So like bracing.
Yeah, almost like bracing. Yeah. Mm-hmm. It's a little different as you start to learn it and you're like, oh, okay. And how that goes into how we perform our daily movements.
Okay.
So with the herniated disc, I couldn't bend over. I couldn't twist. I couldn't do any of these things. So I was like, what's the best way to support my spine? Because I don't have a rib cage up there like I do in my thoracic spine. So what's the best way I can do that? So once I learned this and started to master it, I was like, oh my gosh, this is the turnaround. This is what people need as well. Because, sometimes they'll finish physical therapy, they're out of pain, but they don't know how to move after that.
Yeah.
And then it's like right back to it. They're in pain again. And that's what I wanted to create, like that hour-long session of the soft tissue work, the adjustment, and then like, hey, you're dealing with this now. We decreased your pain, but let's get you moving better so that this is not an issue for the rest of your life. Mm-hmm. But
how interesting. I've never heard of this concept before. I'm probably maybe driving it home again, but like, how does it differ from bracing that like maybe as personal trainers or as your normal gym person, knows? Mm-hmm. How is it different? How would I be able to implement it? What do I need to learn?
So The way that it's different is that typically, this is just from what I've seen and people have told me, is like when they think of bracing, they just think of someone trying to punch you in the gut.
You're right. Yeah.
So with this, and the audience probably can't see, but when I'm breathing, it should be a 360 expansion.
Okay.
The can effect.
The can, exactly. So I give that analogy to patients all the time.
Right.
It's like, hey, your lumbar spine, you don't have a rib cage there. So you need to protect it. And how you protect that is, like you said, the can effect. If I have a Coca-Cola can and it's full, it's very hard to smash.
Right.
If I empty that out, it's going to smash very easily.
Easy.
So that's what that intraabdominal pressure all the way around.
Pressing out through the sides.
Yes,
right.
exactly. You should be able to get it all the way through, and it just fills right up. So that's your natural weightlifting belt.
Right.
So like I still don't use a belt now, and I just rely on that. I just haven't got to that 405 yet. but we'll get there. Yeah.
So that is something that we talk about a lot, right? In terms of like weightlifting and things like that. Like we've seen this concept of, like Edwin said, that can effect and pressing outwards. And I've noticed a lot, like in terms of my lifting and stuff, I feel like that was one of the bigger things that changed my ability to lift from where I was at, right, to where I can lift now.
Yes.
And some of my bigger lifts, I might still use a belt, whatever it is. But even, if I'm, it's very minimal, where it's like, if I'm lifting through here, I'll use a belt. I usually only use a belt when I'm like 80% of my 1 RM,
Yes, definitely.
anything below that, I'm not using a belt.
Because 1 RM is 100 pounds.
It's 100 pounds, so it's 2 teddy bears on the bar.
We all start somewhere.
Thanks. Thank you. Yeah.
So do you even teach, so you take the canning effect and then underneath where the pelvis is, how to can down a little bit?
Yes, definitely. But with these so I'm teaching that, but at the same time, I'm teaching them how to do it through movement. So there's a protocol with the dynamic neuromuscular stabilization, and it all starts from the ground up. And put in these positions, you can tell, like, you can see where people's weaknesses are when they're trying to get their mind, their muscle, and their breath all together.
For sure.
You'll see the patterns just collapse.
Right.
And that's where people are like, oh my gosh, like this is so
hard.
hard. Yeah. But I can relate it to what's going on, issue wise, like the complaints. And it's pretty amazing to see and to get changes when they start to realize, oh my gosh, I started doing this, and after my lifts or regular daily activities, I feel so much better. I don't feel that tension anymore. Like it just seems to disappear.
I like this, man.
It's really cool. Yeah.
What I like about the practice most is that you're incorporating multiple things. So you're incorporating chiropractic work, but also almost like I can't say it's physical therapy, but corrective exercise.
Yes.
To get them back into the bigger movement. And so me and Nathaniel talk about a lot of times when you're correcting things, you need all 3 phases. It helps support the whole body.
Yes. Yes.
A lot of times people just, it's only this. Like you're saying, people go to physical therapy, get injured because they don't know how to move. Or people have gone to a chiropractor, get adjusted, feel better, and then it doesn't fix the issue. You're trying to completely fix the issue all the way through.
Yes, exactly.
And so when you came up, so now if you wouldn't mind telling us how you got into your own practice, how did you end up owning your own thing?
Yep.
How did that come about?
So with that, it was, honestly, a little bit was I wanted to be closer to family.
Sure.
Right? So I was like, hey, I want to be closer to family, and I wanted to be able to do all these different things in my practice, but there's not many chiropractic places that do that. So I was like, okay, well, I'm not going to go back to adjusting every 10 minutes, and especially with the way my back was. I was like, there's no way I can even do it. So I was like, let me create this. And that was really about it. It was more of I had no choice, but at the same time, I believe in it so strongly that I was just going to go and I was just going to do it. But
you said closer to family. So are you from San Antonio?
No. So I'm from a very small town. It's called Herrera, Texas. So it's about
where's that at?
So if you drive down to the valley, It's basically a stoplight, and yeah, you pass right
You're
through
not
it.
serious, man.
Serious.
That's crazy, dude.
Yeah, very small town. So, and I was talking to a patient about this the other day because they were, you know, asking me the same questions y'all are, kind of like, why do you do what you do, and like what got you to do this? And I told them it was one of those things that there's a saying, I might say it wrong, but be the person that you wish you had.
Like, be the change you want to see in the world.
Yeah, kind of like that, but also like who you needed when you were younger. Yes, because I think about it now. It's like, man, my performance, all the injuries that I suffered, being from a small town, you don't really have those resources. So
the
it's
tools.
Yeah, and I've always tried to, even now in practice, is like I'm still learning, and I'll do continuing education that's not even part of my continuing education that counts just to gain that knowledge. So
yeah.
But
Yeah. What does like an assessment look like for your practice, so they kind of know, like, going in, what are you doing? Are you trying to just connect, or are you just like, hey, let me see this, and this?
So it's definitely a connect first. So there's that consult, and it's like, hey, what are we doing on the daily? Do we work out? How long has this been going on? And from there, it's like movement assessment, and it's just global range of motion in the neck, thoracic spine, lumbar spine, checking dorsiflexion in the ankles, where's that range of motion, internal, external rotation through the hip, and then just a basic squat. And then I always also check a modified, just kind of bird dog, because I want to see where that core stabilization's at. And because especially if they're coming in with back pain, like I said, in my experience, that was like the turnaround for me. So I always check that. Then from there, we'll go on the table, and that's where I'm basically just palpating muscles, checking, the joint fixations, and kind of just making these connections. So when I see a patient, it's basically, I tell them, I'm putting the pieces to the puzzle together. There's a lot going on. Just because you have pain here doesn't mean, oh, I just got to work on that. There's so many other factors. And then some of those, the main factor sometimes is just, hey, they were lifting wrong at the gym. They already had this dysfunction, and now they're just building on top of that. And they never really give it a break, and it's just getting worse. But that's really about what an assessment exam would kind of look like, to be able to see everything.
Why do you think that? So the world of chiropractic is a little bit of a mystery to me. I don't know too much about it. I myself have never had any chiropractic work, so I don't really know what it's like or anything like that. I've only heard stories or things from other people and stuff like that. Why are most chiropractic places, or I don't know if I could say why are most of them, but I've heard majority are more of that sort of in and out 10-minute type thing. Whereas opposed to, like someone like you, I don't think I've even really heard of anybody that does chiropractic work.
This is why I told you have to meet them.
Yeah. I know.
It's very rare.
I've been waiting. Yeah.
It's very rare.
And so why is that sort of the setup? Even though from what it sounds like, from what I've heard, is like schooling, education, and things like that sort of point more toward what you're doing. Yet most chiropractic facilities are sort of this in and out.
Yeah. And a lot of that has to do with insurance. So,
Freaking insurance.
Yep,
man.
exactly. Your insurance, chiropractic wise, is only going to cover so much, which is typically why people at the most, and this is pretty rare too, 30 minutes is the most you're going to get. Yeah, places where you're there for like 10 minutes, and so this is why I don't take insurance.
Yeah.
Because I wanted to give that full service. Everything's still under the scope of my practice through the state, and I've done that extra education. So a lot of times too, not mentioning names or anything, but some chiropractors don't have that extra training, and they don't have those extra certifications, so they don't know how to incorporate that too. So that could be the another reason why.
I think you're like coming to the conclusion we've come to is like you need a well-rounded kind of practice, because in personal training we do the same exact thing. We do a whole full body assessment, and then we go get to know the person, And then we talk about their nutrition. Like we even talk about how their nutrition could affect their pain.
Yeah. Mm-hmm.
Do you go through things like that with them, like nutrition wise a little bit?
Nutrition wise, that's more something that will come up as I start to see the patient.
Okay.
Yeah. So I don't bring it up right away. I want to just put that puzzle together first. It's like, hey, and if we're seeing kind of some hiccups alongside, it's like, hey, what are we doing? Like, what are we eating? What are we consuming? And kind of go from there. Sometimes it'll just come up in the consultation because patients know too.
Everybody knows.
Yeah, so
They
everybody
know.
knows. So I always keep that in mind, and it's just like, hey, remember when you said, and yeah, you're right. This weekend was, I went on vacation and drank too much or whatever the case is. But
what do you find in people that don't have the best nutrition? How does their body react? What are the things that change? What is their recovery like?
Yeah, man, that varies. It really does. From what I've seen, it varies, but everything's just at a low. The recovery, the sleep, depending what we're eating at night.
You get a lower threshold.
Yeah. So, people who, I've noticed this, people who consume sugar late at night, their sleep levels are just, really down. They're not getting that quality of sleep. Sometimes nightmares. I've heard that before too.
Weird.
And we make those connections. They're like, oh yeah, you're right. Like I have been kind of experiencing that. And I'm not saying that's the reason why, but I do see that sometimes.
Yeah.
So.
Dang, that's interesting.
That is.
Yeah, have you ever had like a patient where it's not even like bracing or core, but like you said, you measure your dorsiflexion. And so I'm assuming you're looking at feet, the way they walk, and you just see the way they walk and like, oh, that's it right there.
I can, so it's funny because I study people all day, whether I'm in the clinic or not. Like it's something that it's just, like I said before, like I'm fascinated with how people move, anatomy, everything. And
I'm always staring at people
I can see some people walk in and I'm like, okay, I kind of already know what's going on.
Get on the table.
Yeah, exactly. Yeah. And, and the important thing is making people understand these things of how their movement patterns are keeping them in pain. And my favorite thing in the clinic is just those light bulb moments.
Yeah.
It's like, hey, do this again, change this. And they're like, oh my gosh, that makes a huge difference. I'm like, yeah, okay, so let's keep doing it that way. We'll still work on the soft tissue that's, been tight forever because of these bad, patterns. But that's going to make a big difference.
Have you ever run into anybody who maybe like doesn't believe in it? Who like maybe is kind of resistant to change, resistant to doing the work or something?
Yes, I have. So, and this is something, I don't tell my patients this, but I always think of it. It's, there's a saying like, if you do the same thing over and over and over and expect a different result, like
it's
what
the
is that?
Definition of insanity.
Exactly.
Yeah.
So, it's definitely something people got to be open to, especially if they've never seen a chiropractor before. They've only heard like you, like, okay, it's like, oh, they're just going to adjust you and see you later. So I get that. And I've had people be very skeptical and, it's with those cases too, sometimes they're really difficult cases.
Yeah.
And I'll tell them, I was like, hey, I'm not going to fix you in 1 or 2 visits. There's a process to this. And I break it down. Like I have on average of what I see with patients on, certain conditions that they have. And I'll tell you, hey, within this many visits, this is what we're going to be seeing. Next set, this is, I break it down for them so that there's a goal in mind as they're going along versus like, hey, let me try to fix you. Oh, we're done with our session. How are you feeling? Like there's things that they can measure. So a patient right now, she's at the end, going towards the end of her plan. Everything has been spot on. And I asked her, I was like, so how would you rate, like, where would you say percentage wise you are, being back to normal? She's like, I feel like 90%. And she's like, and I feel it's that missing link that you said we're going to work on. And that's where it's like, okay, like we're on track. But
Dude, this is amazing because I told Nathaniel when he came on that nobody in San Antonio does it like this.
Yeah.
And
do you even know of anyone in San Antonio that's doing the same kind of work that you are?
You tend to look at competition,
Of course.
So it's just, so I found nobody. I know there are some in Dallas and up north at a few states, but it's very rare.
Why is it so far behind?
I think I'm going to be honest.
You can say it.
Yeah, I'm going to be honest. I think it's more of a insurance thing, a money thing. What brings the most patients in? How many patients can I get in? Because you got to think of it like, I'm spending an hour with you. I can only see so many patients a day.
Whereas they can see 6.
Yeah, they can see 6 in an hour. Exactly. So that wasn't really the goal for me.
Right.
Like I said, coming from my injuries and experiencing that debilitating pain and knowing what it took to get through that, I wanted an answer for people.
Right.
So the patients that are seeing me they've already been to Chiro, they've already done physical therapy, they go to massage therapists, and they're just amazed of like what I'm able to provide for them. And it's just very rewarding when they kind of mention things like, oh, where were you 20 years ago? I've been doing physical therapy for so many years. And
it's validating.
Yeah.
So on that note, I'm going to take it here.
Yeah.
How do you feel like social media has affected chiropractic work, your space, what people expect, what they think it is? How do you feel like that's changed?
So with that, of course, everybody wants likes, and it's all about the wow factor. And so it's just a bunch of adjustment videos.
Okay.
And I'm a little guilty myself,
Sure.
I throw it in there here and there, but I also make sure that I put helpful tips, whether they're dealing with knee pain or let's say they're getting back to squatting, things like that. I always make sure that like, hey, yes, I adjust, but at the same time, there's much more. And so hopefully they get help from those videos that I put out on the Instagram. But, you shouldn't expect what you see on Instagram. It's not always a amazing correct every single time. There's other factors that, have to be addressed. And this is why I do all the soft tissue work as well. Because if a muscle is so tight and I tell patients it's kind of like a dance when it comes to the adjustment, because if you're going to be there, hold your breath and be bracing as I'm trying to do one of these adjustments,
it ain't going to work.
Two things are going to happen. It's not going to work, or I'm going to try to force it and potentially strain a muscle, something like that. So, and that's a good thing about, when I see patients, it's very kind of just detailed on the adjustments. I don't adjust every single spot. It's like, hey, if you need it, you need it. If you don't, I'm not going to adjust it, which a lot of chiropractors will do that. They'll just they call it the flying 7, but
the what?
The flying 7 is just like the top 7 adjustments that they do.
Okay. What are those?
Yeah.
What are the?
So it'll be, cervical neck adjustment. You got the 2 sides, you got the lumbar spine, you got the SI joint. Those kind of, it depends, but, you got the thoracic spine, you might have a wrist, you might have the ankles. It's just, I don't even know them exactly because I just don't do them.
Good.
I don't believe in it. It's like, hey, this, because I'll check the joint range and I'm like, hey, this is moving good. I don't need to adjust the other side of your neck.
Fine.
Like,
Do you feel like if they get the adjustment, they're just making it worse a lot of times?
Sometimes it could be the issue. So you have people who've been to chiropractors before and they've only got adjusted, and now they're like scared to move. They just think like they're just going to turn their head and then that joint's going to be restricted again. And it just doesn't happen that way. But if we're continuously just adjusting something that doesn't need to be adjusted. We're just kind of hypermobilizing that area, and this is why I don't adjust the same area over and over and over unless it's something that's been there for 20 years. And it's like, okay, I'm still feeling like a major restriction. Let's get some movement through there.
So we talk a lot about when training comes that we do a lot of small steps and we'll build on the small steps. It seems like your chiropractic work is a lot of small steps. And then towards the end, you're like, okay, let's reeval. And then we'll see what steps we need to go from there.
Yes.
What is something that you see, or there are certain exercises that you look at to say, okay, you're done. You can move on to weight training on your own or with a trainer.
Yes.
You're like, okay, you're good enough to go. But if you want to see me maybe once a month to make sure we're still moving properly, is there stuff like that you do when someone's ready to leave?
Almost like assessment-wise?
Assessment-wise.
Yeah, definitely. And it's not so much of the assessment, because I spend so much time with the patients that I know their bodies so well.
Yeah.
And when they come in the next visit, I'm like, hey, how's this doing? Or how's that doing? They're like, yeah, it's still. I was like, that's what I expected. Let's go ahead and work on that some more. Like I said, everything's built into these phases. And once we're at that phase, that end phase, it's like, hey, you're ready to go out. I feel like I bulletproofed your body as much as I can with my, facility and skills and all that, to where you can go ahead and go work with a personal trainer and build up on top of this. But it's not really a true assessment, because like I said, I spend so much time with the patient. I know where they're at already.
You can see the progress.
Yeah, exactly.
Yeah.
Yep.
Yeah, it's crazy because I see some of my clients walk in. I'm like, okay, we're going to have to change my plan. It's that same concept.
Yeah,
Like,
it's hard to even write programs sometimes because people will just come in and I'm just like, okay,
Yeah.
everything I had planned today, it's not going to happen.
Yeah. So and sometimes things like that do happen, because you have these. Sometimes you think treatment's going to go a certain way, and then there can just be this hiccup where it's like whether they did something wrong or, like I said, it's putting the puzzle together. And so I'll give you an example, and this is more for, like with me. So it started out herniated disc. Okay, let me kind of work on my core stabilization. I can't do much bending, twisting, things like that. So let's do that first. Once the disc calmed down and I wasn't having that intense pain, now I was like, okay, well now my right side is really locked up and I'm having pain there. Took care of that. Starting to get more mobility again. And now it's like, okay, I'm finally getting back to flexion. And now it's just that TL junction. So that kind of lower to mid area just felt like it was going to tear as I was moving. So it's like, you need to be able to adapt to these compensating factors that happen when someone's hurt. Like I said, it's not just that one spot. It's going to be somewhere else later. So if you're going to someone, you're just seeing them once a week, they're not truly going to know your body to be able to make those changes right away.
It's like in movies when there's like a boat that's sinking and they like plug one hole and then like something else pops
exactly,
out.
yes.
Yeah. And you have to, and we see that too in training where it's like, okay, we fixed one thing, but now it exposed another issue.
Yeah.
Right. That was being covered up by that.
Exactly.
And then now we have to fix this, and it kind of goes along in that sort of pattern going through it.
So when I do the consultation and stuff, I let them know that ahead of time. It's like, hey, this is our focus right now, but there's going to be some things that kind of come up that are related to this.
Setting an expectation.
Mm-hmm.
Yeah.
Yep.
Which I feel like is important, especially in chiropractic work, where most people will probably expect you to be like, hey, I'm going to be fixing this one session, right?
Yes.
Yeah. And then they're like,
I get those calls.
yeah, that's crazy, man.
So unfortunately, I turned those away.
Wow.
So whenever I get those calls, though, I try to educate them.
Yeah.
Like, hey, even though you're not the best fix for me, this is what I think is going on. Just, it's not medical advice really like, oh, you got to do this, but just letting them understand what they actually really need for the issue that's going on. Mm-hmm. So if a patient didn't come to me, I just hope they got some type of education that was like, when I see my next provider, maybe I should think about these things.
Helps them think a little differently.
Mm-hmm. Yeah.
What are your top 3 exercises that people should be doing to like bulletproof their back? Like
Okay.
you said, what are the top 3 exercises in the gym you think people should do done properly?
Yeah, exactly.
Yeah.
I'm glad you said that, because I have patients that'll show up and they're like, oh, I've been doing this exercise and this one, and I'll have them do it. I'm like, ooh, okay. I was like, we need to fix this.
Probably stop doing
Yeah,
that.
exactly. I get that all the time, and they're like, yeah, I saw it on YouTube, and I was like, okay,
Awesome.
there's a difference when someone's watching you and correcting you.
Yeah.
Your bulletproof vest back has a hole in it.
Yeah. A giant tear.
Yes. Back. You know what? I will always implement the McGill Big 3.
Okay.
Yeah.
Very cool.
Always. Because like I said, coming from the disc herniation, core stabilization, doing those right, like that was a lot of my rehab starting off, you know.
So for people listening, the McGill Big 3 are the bird dog, right? Side plank.
Yep.
And then
Crunch.
The modified crunch, right?
McGill curl up, yeah.
Yeah. Can you tell us why those 3 are the most important sort of like core exercises used in rehab or in just learning core stabilization in general?
So really it's because there's no flexion involved, really. You know, there's no twisting, and it's all stabilizing that core. It's a little
like
hard
isometric.
to explain. Isometric, yes. But at the same time, with the DNS work, the dynamic neuromuscular stabilization work that I did, I'm incorporating the 2 together. So there's that other component to it.
So while they're doing these exercises, you're also telling them to create that sort of that 360 bracing.
Yes. Yep.
You're doing a lot of anti-rotation work.
Right,
Yes,
anti-rotation
definitely.
work, stabilization,
Definitely.
things
Yeah.
like that. So do you think rotation is important
I do think rotation is important at the right time.
at the right time?
Yes.
Okay.
Yeah.
When would be the wrong time and when is the right time?
And that's a little hard to say, just because it depends on the condition.
Sure.
You know, if it's a herniated disc, we're definitely not rotating for a few months.
Yeah.
You know, it's just, you know, they've done studies too, where they do the MRI, they see the herniated disc, and then they see where it's at a year later, and they go off the treatment. Maybe they say they're seeing a chiropractor who, when they did adjust their back, they're doing this crazy rotational type of adjustment. Those are the cases that got worse over the year versus those other style of adjustments.
Wow.
So that's very important. Yeah. So, you know, a little bit back to my own story, sorry, but I think people should know. But, you know, there's a difference between knowing what to do textbooks wise, you know, the things you learn. You're like, oh, okay, when you see this, this is what you're going to do, versus having that knowledge and then knowing how it actually feels.
So like applying it.
Yeah, applying it. Exactly. So that's where I'm kind of coming from when I treat patients. And unfortunately, fortunately, whichever way you want to see it, I've had so many different injuries that I had to go through that I can relate to a lot of my patients that come in.
I feel like that's important, right? Not like saying like, hey, if you're a professional, go out and get injured.
Yeah,
so you can,
yeah,
like, come back
exactly,
and
right?
relate to your patient.
It's just my story.
Yeah. But I think it is important to like practice what you preach,
Yes,
right? Yeah, in the
definitely.
same way that we do.
Yeah.
You know, when I have my clients do exercises, I'm like, I've never had you do an exercises that I've never done myself,
Yes.
right? I've never, you know, maybe I haven't gone through those types of things that you've been through, but I know that this is sort of the plan, you know, sort of have
Yes.
in mind for you to do, et cetera, things like that, which I think are important because at least in our space, like with training, and maybe you see it in chiropractic work too, where it's like, you know, we can totally see when a trainer saw a YouTube video, you know, earlier that week and is like, now all 20 of my clients are going to do a single leg
Yes.
Bosu ball cartwheel, you know, and everybody's like,
Yes.
this is so cool and they've never done it. Is that, do you see things like that in chiropractic too, where it's like some people, where like, I don't know, a new fad comes out and then now everybody's doing it regardless of whether the patient needs it or not?
Yes. And
Man, we're so human.
Yeah.
I'll throw it out there. It would be the occipital lift for me.
Occipital lift.
That I
Okay.
see.
So like
So
pulling?
Yeah.
Like the little Y thingy?
Not the, well, that too.
Okay.
Which I would never do.
Matthew,
personally.
I want that done with me, bro. I want someone to pull my head off.
And I'll do a variation of that depending
Okay.
on who it is and if they actually need that type of decompression work. But it's never the Y strap.
Why does it even exist?
Loud pop.
A loud pop, probably. I honestly do not know.
That's crazy. So it's not something you learn about in school or anything like that?
No.
What the hell? Who made that shit up then?
I don't know.
That's
That's why I
insane,
don't
bro.
do it. Like I said, same thing with, like you said, like you don't have your clients do anything that you wouldn't do.
Yeah.
So if I wouldn't do the Y strap,
Why
I'm
am I
definitely
gonna
not
have
going to be
you do
doing
the
it
Y
on my
strap?
patients.
Yeah.
Yeah.
I just want to be hanging from the ceiling, floating around.
So, our body's complex. The spine has a bunch of nerves going out.
Yes.
Do you ever see when you do an adjustment that maybe their bowel movements got better or sleep, other things besides, we talked a lot about the physical, but other things, maybe their stress like goes down?
No,
Stuff like that?
definitely. I so it's not something that they have like a ton of studies on, with the bowel movements and the sleeps and
Maybe
stuff.
it's more anecdotal.
And more anecdotal, definitely. But I've seen it, and patients will tell me like, "Hey, I noticed this or I noticed that. Does that have anything to do?" And I'm like, you know what? I've heard that plenty of times. It's definitely anecdotal, but like the actual research behind it isn't quite there yet.
Do you think there needs to be more?
Yes, definitely. The only thing is it's hard. I feel like it's hard to kind of study
Keep controlled.
that. Yeah, keep
Yeah,
controlled.
that's
exactly.
fair.
Because you're asking people what they do. Like,
Yeah, it's like I took a huge dump today. yeah.
it was 'cause of my
Is that normal? Yeah.
No, I don't think people think about the nerves that run through the spine, and if you're just misaligned a little bit,
Yes.
how it can affect a bunch of other things. And in your case, it was literally your hand, right?
Yeah.
Some people, it's like, I'm not feeling their feet.
Yep.
I mean, I could think many reasons why to go to you, just because
Yeah.
it's stuff I cannot do to
Right.
adjust somebody. And I know the difference.
Speak for yourself, bro. I don't know what you're talking about.
You're touching
I can do anything, man.
You're touching your clients like that. You're like, oh,
Yeah, I'm like, like I got a Y strap here. Put this on you. So let me ask you this question. So I've heard, like a lot of times through like research or just like again like anecdotal things that you hear, people say that like most of us have some sort of bulging disc throughout our spine. Is that a common thing? Do most people really do have that, or is
So-
that something that's not?
And that's what I've seen study-wise as well. After a certain age, there's a high percentage of people that do have bulging discs that don't even have pain.
Is bulging disc always indicative of like some sort of pathology? Does it always mean there's something wrong?
Not necessarily, because if you're able to perform everything without pain, then it's,
If it ain't broke, don't fix it.
exactly.
Yeah.
Exactly.
Okay.
Yeah. But I do tell patients that, whether you have a bulging disc, a herniated disc, whatever I find in the consultation and the exam, it really doesn't change too much of what we're going to do moving forward. Now it varies on what they can't do. If it's flexion or extension, then of course that changes. But I feel like too many people, they get a diagnosis and then that becomes them.
Yeah. Okay.
And so I don't like to put that fear into my patients.
Definitely.
And now it's like, because I feel like the biggest thing for me coming back from the herniated disc was just my belief that I was actually going to get better. I had other practitioners that were like, hey, you need to go see this spine doctor and he's going to give you an injection. And then, I got all the recommendations. I was like, no, like I don't.
Did you ever have surgery?
No injections, no surgery. Like I said, like that. It was a long process, painful in the beginning, but I was able to turn it around.
Man, see, I got a question too. Go
Yeah,
first. Go, whatever, man. Go.
do you feel that a lot of back surgeries could be avoided? And if you could throw a percentage out there, I'm going to put you on the spot. I know it's not like going to be a good percentage, but what percentage of people you're like probably didn't need back surgery? I know what percentage I think. I've even said it on the podcast.
Okay.
It's a very high percentage that I don't think that needs back surgery. What do you think for the most part that you've seen?
Gosh, man.
On the spot.
Yeah.
Get the light. Put it on
It's
the
funny
video.
because it's also shoulder as well.
Mm-hmm.
There's a ton of people that don't need it.
Mm-hmm.
You know, I've had people come in and see me and
Or knees.
go like this, and that's all they have. And after a few sessions, they're back to normal. You know, and it's just applying the right tools and, you know, doing the right things.
There's a lot of times when I was working at a physical therapy clinic for a while, that like the patients I saw that seemed to be in the most pain and seemed to like get the least amount of relief were shoulder patients and back patients.
Yeah.
It always seemed super painful. Number one, I felt so bad for them. Out of everybody, I was like, shoulder patients, man, I could just see the pain in their face.
Yeah.
And back patients too. Because at that point, like the pain just kind of consumes your life. Like you said, right? It sort of just like becomes them. And I don't think we talk about how much it like really does, like I said, consumes their life and takes a hold of a lot of the relationships, jobs, their relationship with their kids, like all of these things like that. I remember a lot of the times, and I wonder how, if you've ever had to deal with it, or what's your opinion on like spinal fusions? How do you deal with those types of things? Do you think those things are actually like necessary? Is there better ways to go about it?
So I think there should always be some type of conservative care first. You know, hopefully they can find a practitioner like me or a physical therapist that is going to spend that kind of time as well. I think that's the first thing you need to do. Now there are going to be some cases where it's like, hey, this is just too far gone. Like this is what it is. But there always have to be some type of conservative care first. Now, some patients don't want to do that though.
Yeah, they do just want to get the surgery. Yeah.
It seems like your theme is like spending time with the patient. And it seems like most, even physical therapy, the way they're built and constructed, it's all based off of insurance leading the way and what's most profitable for them.
Yes.
And it seems like not enough people take enough time. And I always tell my clients, a 30-minute session versus an hour session is completely different.
Yes.
And what I can get done in those amount of times is completely different. How I'm going to see your body throughout the whole session is completely different.
Yeah.
And
Even so, like where
issue.
I'm at right now, they're 45-minute sessions.
Okay.
And I feel like I am racing against the clock. Like I'm like, I got to get it done.
That extra 15 makes a huge difference.
When I've trained for hour-long sessions, it's so much more laid back. I have so much more time. And I know it's 15 minutes and it sounds like it's sort of like nothing. But even in my own training, when I got to go to the gym and train for 45 minutes, I'm like, set done, moving on to the next set, whatever. When I have an hour, I'm like, listening to my music, I'm like chilling out. I get a little warm up in and stuff like that. So it is really cool that you do it in that way. Let me ask you this. So we can't pretend like it's not a business aspect too, right? Where it is about making money, where these are the things that, these are the reasons why we do our own business, et cetera, and stuff like that. How do you manage being like profitable in a 1 hour sort of package as opposed to someone who, you know, does do 10-minute sessions and they're just making cash, you know, in that way?
And that's where it becomes more of like, I'm just trying to provide value.
Yeah.
You know, quality, just everything. So, you know, an hour of work, people go to a chiropractor for 10 minutes, maybe 12, something like that, pay $85. You know, and of course my price is a little higher than that, but there's
10 minutes, $85.
Yeah,
I'm
exactly.
in the wrong fucking business, dude.
But if you think about it, a per hour basis, the other guy's making more money.
Yeah. So, you know, it makes it a little bit more challenging, of course, but whenever I'm able to get people those results and I know that I'm doing things the way I want to do them and have total belief in that, I think that counts more.
It's worth it.
Yeah.
I think we're getting to the place where people are starting to realize it takes time for anything. Yes. I think it's just
hopefully.
I think it's happening. I mean, I'm getting more clients that come in. Look, I know I want to lose weight, but I know it's going to take me time. They're not as like, oh, I need this done in 3 weeks. I'm getting a lot less people like that.
Yeah. And that's where, you know, when I do these, because I'll call every patient before I even see them. It's like, hey, let's do just a mini consult. Let me just see if I can actually help you and what they expect.
See, man, that's so cool. Because most people would just be like, and we see it in training too, where it's like, person comes in with a myriad of issues and trainer has no clue what they're doing and they're
Yeah.
just like, whatever, I'm going to take it because money.
Yes. Yeah,
right.
exactly.
Whereas I've turned people down. You know, I've had people, you know, come in the past or even now or whatever. And like, I'm looking at their stuff or looking at how they move and things like that. And I'm just kind of like, I think you're like fine, you know, like I think that you might be okay. I don't really know, you know, if you want to continue, let's get better. Or I've had people come in who have like, man, I remember this one time, this guy came in, I can't really talk about a lot of it, but like he was saying some stuff and I was like, I don't think that I'm like ready. Like, I don't think that you're the person for me. I don't think I'm the person for you. Like, I think you might need to go find someone else or, you know, et cetera, whatever it is. And I think that's important, you know, especially in our field to, number one, garner a better reputation, right? Garner better trust in terms of like the whole industry, you know, in terms of all of chiropractic or all of personal training, you know, because if this person comes to me and I promise them a whole bunch of fake stuff and then, you know, I'm going to end up getting a 1-star review and that's going to hurt me.
Exactly.
And then they go around and be like, chiropractic
I see
sucks.
that. Yeah, exactly.
You know? Yeah.
And that's why I always ask for some type of commitment. And I give them that breakdown of like, hey, this within these visits, this is what we expect to see. I'm not going to get you better in one visit. Now, there are cases kind of like with mine, 80% better that one day, but I'm also that person who's going to do the extra stuff.
Right.
You have people who, you know, they're not going to go home and do that type of homework. So it's like, no, you're going to do them here because I want to make sure that I'm giving you my all and you're giving me yours to get that result.
Yeah. Very funny.
Remember that one guy that was like, I want to come in 5 days a week. You're like, you're not ready.
Yeah. Same thing. Yeah. I've had people who come in and they're like, sign me up on the biggest package. I'll be there 5 days a week, blah, blah, blah. And, you know, in the moment, you're kind of like, whoa, that's probably a lot of money. That'd be awesome. You know, everybody will look at me a lot better, whatever it is. But I've literally been like, man, even if I had the time, no. You know, like you'll come in 2 days a week, you know, and they'll be like, what about 3? And I'm like, fine, I guess, you know, but we're not going to do this. We're going to get here. I'm going to help you out through this. Maybe later we can do that type of thing. But we were just talking about that before, right? I've talked people down from that to 1 time a week, you know, to the dismay of lots of people, you know, they'd be like, what are you doing? Sign them up with the big package, you know? But I'm like, no, I don't think that that's what this person needs right now, you know, and I'm here for them. I'm not here for anything else, you know?
Exactly. Yeah. I've turned away a few patients now. And that a little bit was, you know, they kind of told me straight up, like, I don't think chiropractic works, but I've already tried everything. And if I don't see results in, I think they said like 3 visits and their condition, I was like, there's no way. I've helped this before, but it was a patient who was in their 20s, you know, and this patient's maybe they're in their 50s, 60s. And I'm like, I'm sorry. Like if we can't commit to a bigger plan with your belief on chiropractic already, I can't do this, you know, like I'm not going to waste your time and money, but at the same time, you know, mine as well.
I always like to ask silly questions.
Go ahead.
At some point. How do you feel about things like where you see on like TikTok or Instagram where people are like, oh, you know, like I guess like self manipulations, right? Where you know, like where they'll put like their hands behind their head and like pop them up or something like that. Like, do you think people should be doing that? Should they not be? Is it like just like gonna do nothing for you?
So I'll tell you this: the people that do that, it's not necessarily that it's bad, but there's a reason why they keep having to do it. It's not targeting the right spot.
Yeah.
You know, this is why you need a professional to do it. So you don't need to feel like you need your neck all day.
I tell people all the time, I'm like, when you have a plumbing issue, what do? You call a plumber.
Yes.
Right.
Yeah.
If you have a body issue, call a professional, dude. Stop. Yeah. Because then if you go and you watch the YouTube video for plumbing and then your whole house is flooded, you know, you're going to look pretty dumb, you know? Same. And it's even more important with your body, right? Which is funny because I guess there's like that sort of autonomy where you're like, it's my body. I know what I'm doing, or I can do whatever I know, or I know this makes me feel better or whatever it is. So I guess there's more like entitlement to it, which makes sense, right?
Yeah.
But I do think that there's like, I'm like, it's so important though. Like, wouldn't you want to like maybe spend a little bit of money to go like get this figured out and fixed in the right way, you know?
Exactly. And I'll bring that up on my calls usually too. It's like, hey, like what's your end goal?
Right.
Are you just looking to get adjusted, feel better for a couple of days and see me again? Or, you know, are you trying to get this fixed? Are you trying to get, you know, because there's a lot of education that goes into my hour sessions.
Yeah.
So when patients are done, they're like, hey, I was feeling this, started doing this like you showed me, and resolved,
Yeah.
Like give them the tools to take care of themselves, not just, hey, you're going to have to rely on me the rest of your life because you have this diagnosis.
Yeah.
So before we sign off, this will be the last question right here. What are 5 exercises that the average individual should get to bulletproof their back?
Gotcha.
Like what should be their end goal? Not saying they're going to start there, but they should work towards that.
I think, of course, just a basic squat.
Okay.
I do believe they should be able to deadlift, myself, herniated disc. You would think like, oh, never deadlift again. And it's like, no, like we bend down all the time. We're, single leg squat would be beneficial.
Damn.
As
Why you gotta say when that's hard, bro? Don't do that.
I know. Well, you're going to work your way up. Then we're thinking kind of more up there.
Okay. We all start somewhere.
Yes.
Yeah.
What about like a couple upper body ones?
Yeah, I was just going to mention.
Okay, so that's 3 lower body, right? So we got squat, deadlift, and then single leg squat.
Yep.
Right.
I would definitely say a row.
What type of row?
So what I do, and this is just from me, is I always do seated rows.
Okay.
Now-
A cable.
Cable, yeah, with the cable. And I always just make sure that I'm not putting this crazy extension on my back as I'm doing it.
Oh, God, I hate when people do that. Yeah.
It turns into like a trap, right?
Yes.
When I have people do their seated rows, I pretty much have them at a 90-degree angle, pulling in their core, right, bracing through, and I'm like, you're gonna stay right there, and you're gonna pull through and use use a scapula, pull through that way. There's none of this, right? Like going through. So okay, there's 4,
and then. I mean, I think it's really just your basic lifts, your bench. You can switch that up if you want to do incline. But the thing is, everything needs to be done correctly. Because I've had issues, with shoulders surgery. I was still able to get back doing bench once I fixed it.
See, I think that's the thing, right? Where people injure themselves doing the exercise incorrectly, and then they go on this whole tirade of like squats are bad for you, deadlifts are bad for your back, bench hurt my shoulder, I'm not doing that anymore. And then they go around telling everybody else that, you know, and then when I have people come in and they're like, my back hurts, and I'm like, let's practice your deadlift. They're like, you're insane, you know, and I'm like, no, I promise I'm not. You know, I mean, I've helped people with back pain just by deadlifting, right?
Yeah, I literally have a client like, don't take deadlift off my program because I could feel the difference in my back.
Yeah. They want to be jacked, man. Be swole.
Yeah, definitely.
All right, guys. Thank you for listening to the Strength Solutions podcast. We're on Apple and Spotify. You can rate and review us. Also, check us out on YouTube. You can subscribe down below, comment below as well. Then, if you're looking for our website, it's strengthsolutionspodcast.com, and we have free blogs, free guides, and programs on there for purchase. If you want to email us fitness questions, it's strengthsolutionspodcast@gmail.com. And on social media, Facebook, TikTok, and Instagram, it's Strength Solutions Podcast. On Instagram, I'm Strength Solutions Edwin.
I'm Strength Solutions Nathaniel.
Until next time, guys. What?